Hi, this is Dr. Komoshi. I'm GP at King's North Medical Practice. In this series we talk about common medical conditions that could be treated at home without the need to see the doctor. Normally I work at King's North, but today I have an out-of-hour shift in the hospital, so I thought this would be the perfect scene to talk about temperatures, as this is a very common out-of-hour presentation. Here I see patients face to face, and we also have telephone consultations. Between 6 and 10 o'clock there is normally an increased influx of calls from worried parents who have children with high temperature. Sometimes, unfortunately, I don't get around to call them back before 2 or 3 o'clock in the morning, and then by that time a very sleepy parent picks up the phone saying that their little child is now sleeping soundly and the temperature went down, so they're no longer worried, they don't want to talk to me anymore. Well, that's fine, but I still need to ask a few safety questions to make sure that it's safe to leave the child until the morning to see their own GP. The reason for that is very innocent viral infections and serious life-threatening condition can cause similarly high temperatures that settle with time, as this is the very nature of the temperature to go up, especially in the evening time, and then settle by the early morning, regardless of the cause of it and regardless whether any antipyretics, Calpol or Neurophen were administered. So I still need to ask a few questions from the parent to make sure that the child is safe. In developed countries, most children are immunized against serious childhood illnesses, so these are less likely. A few questions are normally enough to reassure everybody. Let's go through these questions now. First, how high was the temperature? Most patients report that they have temperature if they feel hot. Well, when the temperature goes up, we normally feel rather cold and shivery. This is a more reliable sign than feeling hot. However, having a good working thermometer at home is a good idea. Ear ones are the most reliable. Temperature counts as high if it's above 38.5 degrees Celsius. Below that, an acute, serious illness is less likely. The next question: how long has the temperature been going on for? Innocent illnesses like viruses or tummy bugs normally settle after about 5 days. Temperature lasting longer than 5 days needs medical attention. The next question: how unwell is the patient? If the patient is generally well, tolerating some fluids, able to continue with some of the daily activities, or the child perks up time to time when the temperature goes down with or without Calpol, that's always a reassuring sign. If the patient is continuously unwell or deteriorating, then probably needs medical attention. The most important question: where is the infection coming from? We need to look behind the temperature. As we discussed before, viruses like sore throat or cold flu viruses can give you equally high temperature than more serious illnesses like meningitis or kidney infection. So we need to know where the infection is coming from. Based on the presenting symptoms, we have a list of questions we need to ask. For example, if there's signs of cough, cold, sore throat, maybe flu-like symptoms like muscle pains and headaches, we go through the upper respiratory infection pathway and ask questions about breathlessness or chest pain, coughing up blood. These would be signs of a more serious respiratory infection and we need to see the patient. Or if the patient presents with temperature together with stomach pains, we ask about urine symptoms or diarrhea, vomiting, that it might be a tummy bug. If we can figure out where the infection is coming from and we are satisfied that the patient is generally well enough and there's no other concerns, we can give safety advice and advise that the infection will settle without medical intervention. However, if based on these questions we can't figure out where the infection is coming from, most of the time we want to see the patient in person for physical examination. In children, most of the time, if the temperature is the only symptom, then we will find enlarged and red tonsils with exudate with pus. That's a sign of tonsillitis. That's the most common thing in children with temperature and no other symptoms. But obviously we also check the ears and check the chest. We test the urine, and if we find where the infection is coming from, we treat accordingly. But if we don't find the source of the infection, we might want to ask the help of the medical doctors or pediatricians to take over the patient's care and run further tests to find out where the infection is coming from, because that's the most important thing. We also need to make sure if the patient is in one of the high-risk groups. For example, a baby less than 3 months old presenting with temperature always needs to be seen and examined face to face to rule out a very rare but serious blood poisoning called neonatal sepsis. The other end of the scale is the elderly. An elderly person with high temperature again needs to be seen and assessed to find the source of the infection straight away, and it's not safe to wait any time. Children or patients who are not vaccinated. Unvaccinated patients are at risk of developing more serious illnesses, and we need to bear this in mind. People with reduced immune system due to their underlying conditions or to their medical treatment, patients with weak immune system can have serious infections, and we need to have a lower threshold to see them face to face and investigate them further. So this is how a doctor makes that decision. This is the pathway that we use in most patients. But when we are satisfied that the patient doesn't need medical intervention, then we will give support advice how to feel better until the infection settles. It's almost like reflex to reach out for the Calpol bottle or to reach out for paracetamol tablets in adults if the temperature goes up high. We just want to get rid of the temperature altogether. However, the NICE guidelines is very clear. Let me quote it. Do not use antipyretic agents with the sole aim of reducing body temperature in children with fever. Antipyretic agents refer to paracetamol and ibuprofen medication. A lot of parents present with concerns that the high temperature might harm their child. They are worried about febrile seizures if the temperature goes up high. This is why most parents are very keen to bring the temperature down. Also, you don't like to see your child being poorly. You like to see them bouncing around, eating well, drinking well, being playful. However, there's no evidence, first of all, that high temperature on its own will cause febrile convulsion. Seizures happen as the temperature is rising, and it could not be prevented by giving Calpol or Neurophen, because simply we just can't catch it early on. So there's no worry about the high temperature on its own if we know that it's not caused by a serious illness. Second, there's no need to reduce the temperature for the sake of reducing it. The guidelines are clear. If the temperature is above 38.5 and the child is distressed, then give the antipyretic. But if the child is sleeping soundly, please don't wake them up just for the sake of giving the Calpol because it's due and the temperature is spiking in their sleep. It will settle in the morning. Normally 3 o'clock in the morning the temperature starts to go down. Okay, paracetamol or ibuprofen. The message out there is very, very mixed. It depends who you see, when that person was trained, what their personal experience is. They will give you advice. Yeah, just give the Calpol or give the Neurophen or give them together or don't give them together. Actually, there is some evidence that Calpol and Neurophen given together or alternating will bring down the temperature more. However, the patient is not feeling better with slightly lower temperature. It's really your personal choice. First choice would be normally paracetamol like Calpol for most parents, but some of them swear that the child's temperature is not coming down with anything else but Neurophen. If there is no contraindication for Neurophen, then it could be given. So altogether, it doesn't matter whether you give Calpol or Neurophen, whether you give them alternating or together or just one or the other. Just make sure that you don't exceed the daily allowance written on the box and on the information leaflet. Temperature is an immune response. So far we were talking about temperatures caused by infections. However, an immune response could be triggered by vaccines. This is the intention of the vaccine, to trigger an immune response that sometimes comes with temperature. Pneumococcus vaccine is actually more likely to cause high temperature than any other vaccines. The advice is commonly to give paracetamol before or straight after the immunization to bring down the temperature or prevent it from happening. There is evidence that paracetamol reduces the immune response, which is not really our aim. However, the immunization is still effective, especially after the second booster dose. However, ibuprofen is not known to reduce the immune response to pneumococcal vaccine. So in this instance, Neurophen probably would be your first choice. I hope that I could give you some insight how doctors assess temperature, when to worry and when not to worry. Obviously, if you have symptoms that don't fit into this description or you are particularly worried, then you need to talk to your doctor either through your GP practice or it's 111 out of hours. If it's an emergency, then call 999. I hope you will feel better soon. Bye.